Hello everyone. As promised, I'm back for the next chapter of Heal-2-Feel. This is in continuation with lesson 5 and the learnings that we had with it. So here we are going to understand that if at all you have suffered a traumatic experience in life and you are still holding it inside, what are the symptoms and how it will show physically, socially, mentally and emotionally, or otherwise. So let's try and understand together. So let's discuss about the physical symptoms that indicate that you might be holding trauma inside your body. First being chronic pain, which could be in any part of your body, maybe back pain, stomachache, headache, or any other specific region or joint or muscle of the body, but it is not getting explained by any medical test or investigation. You're not able to find the cause of that pain, even though you have consulted many experts. That could be a sign. Second could be your sleep cycle getting affected. Either you are sleeping too much or too less, or you are having nightmares. And these nightmares are lingering on in your active day life also as a feeling of, oh gosh, what did I see? Third, your appetite getting changed. Either you are eating too much, binging, especially on odd times, like in between meals or at night, or you are eating too less or not feeling like eating, having nausea without any cause or without any reason. And fourth is immunity challenges. Your body is not able to come out of any kind of illness. It's trying hard, it's fighting, it's having all kind of help from the medical side, from the age-old home remedies, but still the body is finding it weaker to fight it. These could be the signs of physical signs of trauma being held inside you. Just watch out. There are certain social symptoms that you can watch out for in order to understand if you are holding trauma inside you. Isolation, difficulty trusting the other person, especially when you are in a relationship, having conflicts for no reason or for minor things, but you are resonating them with your past experiences, or sometimes having self-destructive behavior, possibly getting some bad habits like drinking or smoking or self-abuse. So these are certain signs that you can look out for. Very important and less understood is our mental capacity and our emotional intelligence, and how they can be affected if you are holding trauma within you. It's possible that you have hypervigilance, which is maybe getting startled or being on the edge when you are in a situation or in a normal circumstance. Avoidance is a behavior which you might develop while you are suffering a trauma. It's also a coping mechanism, but there is a difference in how you practice with it and how you are aware when you are practicing it. Awareness is a big difference. Either you're coping with it or you're suffering with it. Avoidance can be used both ways. Flashbacks, having some visions in the daylight while you are working, with nothing stimulating that experience that you've had in the history. That could be a sign that you are holding on to some trauma inside you. Having depression or anxiety, these are clinically defined causes or behaviors that you are holding within you, which suggest that you might be having trauma held inside you. There are people who have difficulty in concentrating in different aspects of their life, whether it is a normal discussion, whether it is a meeting or gathering, or just while watching something on TV or on internet. And having emotional numbness. These are very important aspects that you can look out for and know that if your mental capacity or your emotional well-being is getting impacted because of any kind of trauma that you're holding so dear inside you. There are certain other symptoms that might indicate that you are holding some unresolved trauma inside you. Low self-esteem, not feeling worthy enough for something that you are getting in life. Having guilt or shame about something that you experienced in the past. Or perhaps just not being able to enjoy anything, the happiness, the good luck, the fortune that you're receiving in life, just because you feel, how is this happening with me? It never used to be this good. All of these could be combined or individually signs of unresolved trauma held inside you. It's not something to hold inside you. It's something to throw out. This is garbage. You don't deserve all this. You don't need to have all this. And if you have, and now you know, don't defend it. Don't say, I do have it. I have things that I can't share or I don't want to share. No. Share. We are humans. We are born in this way. We are made in this way that we formulated a society. We are there for each other. We have to be there for each other. We have to exist as social beings, being kind to each other, listening to one another. And if someone is probably wanting to stay alone, make sure that they are in good condition before you agree to leave them alone. If they want to talk, try to hear the content without being judgmental or jumping to a conclusion and offering something as a solution. Maybe they just want to be heard. Maybe you just want to be heard. So, I'm here. Please share. Please tell me. And I'm here to help you. Let's talk.